Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Hi, let me introduce. My name is Yuzki fardianna. I come from Ponorogo, and now I am a student at Muhammadiyah University of Ponorogo. Here, I will explain about wound care. Wound care is an important procedure that needs to be done when you experience a wound or injury to the skin, and there several types of wound care. Based on the type of wound care is divided into two types. 1. Minor wound care. Acute wounds occur due to tissue damage to trauma. This type of wound can be caused intellectually, such as a surgical procedure. It can also occur due to accidents caused by blunt objects, projectiles, hail, electricity, chemical, of friction. This one can usually heal by themselves, but it is better to take initial action such as using an antiseptic or keratin oils. 2. Chronic wound care. Chronic wound care, what you cannot be treated and treatment for a certain period of time, usually 4 weeks. And inflammation occur. Chronic wounds are you also often associated with intrinsic and extrinsic factors, such as medication for nutrition or comorbidities. This type of treatment usually requires medical personnel. Wound care procedure. Minor injuries actually do not require intensive treatment from a doctor because they can be treated at home. First, wash and disinfect the wound to remove all dirt and bacteria. Use pressure to control bleeding and swelling. Second, when dressing a wound, always use a sterile dressing on bandage. Very small, one can heal without a bandage. You should keep the wound clean and dry to 5 days. You should also get plenty of rest. After that, you can do the following steps. Stopping bleeding if it continues by gently pressing the wound using a strail of clean cloth. Position the wound facing upwards. Routinely rinse the wound with clean water. The area around the wound can be cleaned with soap, but not over the wound to avoid irritation. If there is a small object stuck in the wound after cleaning, use a sterile tweezer, which have been cleaning with alcohol to remove it. If something is still stuck, seek medical help immediately to reduce the risk of infection and tetanus. There is no need, there is no need to use hydrogen peroxide or medicine or cleaners containing iodine, which can irritate injured tissue. Gently apply antibiotic cream or ointment to help keep the skin surface moist. This drug and prevent infection and help the natural healing process. However, if a rash appears, stop using the treatment immediately. Cover the wound with a sterile bandage to help keep it clean and free from bacteria. If the wound or serrage is small, there is no need to bandage it. Change the bandage regularly, at least once a day or every time the bandage gets wet or dirty. If the wound is deep enough, gaping, and visible fat or muscle, immediately go to the doctor or hospital to get stitch or other necessary treatment. When should you see a doctor for wound care? Even though you can do treatment at home, you should still see a doctor. 1. Open wound deeper than 2. Bleeding does not stop even with direct pressure. 3. Bleeding lasts more than 20 minutes. for breathing result from a seriously accident. Wassalamualaikum warahmatullahi wabarakatuh.